I'm getting to the point right now in the past 2 weeks where I'm legitimately concerned that we are going to run out.
Throughout the pandemic, concern about shortages of ICU beds and ventilators has been top of mind. In fact, right now, data from the State Department of Health shows only about 18% of Indiana's ICU beds are available. Meanwhile, 64% of the state's ventilators are available. And one Indianapolis nurse tells us that this is the first time since the beginning of the pandemic he sees the lack of ICU beds becoming a major issue. His hospital and others across central Indiana overflowing with COVID-19 patients. Our Alyssa Donovan explains how these facilities are running out of beds and running out of resources.
Yeah, on call last night, and I have never in 15 years seen the emergency room so busy.
Dr. John Hathaway is an OBGYN with IU Health. Last night he was called into the emergency room at Methodist Hospital. He was shocked by what he saw.
The beds were literally lined up head to foot in the hallways because there were not enough patient rooms for people who are coming into the ER.
The situation similar at other area hospitals.
We're at capacity for what we have the ability to care for right now.
Greg Buckingham is a nurse with Franciscan Health. He says right now there's nowhere to put incoming patients.
So I'm talking, anywhere from 10 to 25 patients that are just in the emergency department because we don't have anywhere to put them.
ICU beds are full, and with several hospitals experiencing a shortage of nurses, there simply are not enough resources to go around. Despite that, the healthcare systems are still taking in transferred patients from outside Indianapolis, even outside Indiana.
We have gotten patients from several states away because there are no ICUs able to provide that care close enough to them.
A majority of the ICU COVID-19 patients are unvaccinated, and Hathaway says the beds are also going to more and more pregnant women.
We're seeing many more pregnant women intubated than ever before.
The doctor devastated to watch a young mother pass away from COVID-19 last week after delivering her baby.
We've had to deliver babies early, like very early, 26, 27 weeks. Which only has a 50 to 60% survival rate for the fetus. And we've had several moms die even after we've delivered them. And so these poor children are in the NICU at 27 weeks, 3 months early, and will never meet their mother because their mother is dead.
Hathaway says some pregnant women expressed concern about getting the vaccine and the impact it would have on their child. He says it's much safer to get vaccinated, especially with the highly contagious Delta variant causing a surge in cases.
Please just get vaccinated, if not for you or your baby.
The message right now from healthcare workers, please be patient and get the vaccine if you can.
I know people are skeptical, but if you look at the actual statistics and the data, not what somebody's posting on Facebook, it really is the best way out of this pandemic.
I'm Alyssa Donovan, WRTV.
The healthcare workers we spoke to say that the concern with the high volume of COVID-19 patients is not only a challenge, but it could cause issues for others. If you are in a car accident, have a heart attack or stroke and need immediate help, the resources are just stretched so thin. People with any health emergency could be in danger.
The state's COVID-19 numbers are still increasing, but there is some encouraging news in the data. According to the Indiana Department of Health, newly confirmed coronavirus cases are up today, but the number of new deaths is down compared to yesterday. The 7-day COVID positivity rate hasn't changed. It remains at 11.8%. Slight improvement to report in the number of COVID-related hospitalizations. The state confirms as of yesterday, 2,527 people were in Indiana hospitals either with COVID or symptoms that could turn into COVID. That's actually 160 fewer patients than on Monday. To sign up for a COVID vaccine, just go to the website ourshot.in.gov, or you can dial 211. Many clinics also accept walk-ins.